Dem spokesman Will Forster.
Thank you, Mr Vickers. It is a pleasure to serve under your chairship today. Every single death linked to drugs is a human tragedy. I think we've heard that from the speakers already. It destroys families, it shatters communities and places immense pressure on our health services and the emergency services. In my constituency of Woking, we have had 7 drug-related deaths in the last year figures were available. That is 5.4 deaths per 100,000 people. In Glasgow, that is the numbers are 41.1 deaths per 100,000 people. That shows the scale of the problem in Scotland, but particularly Glasgow, which means we need to have a different approach, and the approach must meet the scale of the problem, of those numbers and the human tragedies that lie behind them. I commend the work of the Honourable Lady for Glasgow West and the way she introduced this debate, but also everyone on the Scottish Affairs Committee for their work to understand drug use in Scotland. The Liberal Democrats welcome the work in Scotland to treat drug deaths as a public health issue, notably through the pilot of Glasgow's Safer Drug Consumption Facility, the Thistle. We recognise the complexities of the devolved responsibility and emphasise that matters specific to Glasgow and Scotland are for the Scottish Government to address. However, what happens in Scotland can still offer lessons to all of us across the United Kingdom. What we need to do is to move nationally towards treating drug misuse as a health matter. That means moving leadership on drugs policy from the Home Office to the Department of Health and Social Care. It means investing sustainably in more addiction services, in rehabilitation support, so that help is available before people take the misstep that costs a life. That approach is reflected in some excellent state and local private provision across the country. I want to commend the Priory in my constituency of Woking, who I visited last year, for the outstanding work they do on mental health and rehabilitation related to substance misuse. We must bring drug recovery infrastructure into the 21st century. That means more trained professionals, better community support, more housing for people in recovery, and pathways into employment to rebuild hope and dignity. Yes, I will.
Colleagues for taking intervention. It was really just to put on record that one of the things that I think is advantageous about the Thistle is that it doesn't exist in a vacuum. It can refer people on to other services, such as housing. Many of the people that are being dealt with are homeless, unfortunately. But it can also address mental health issues and can forward people onto the requisite services that they really need to access. It can also just do basic things like allow people the opportunity to have a shower, to get some clean clothes, to have those basic necessities that the rest of us take for granted. So in that way, it does more than just address this relatively straightforward issue of injecting. It also tries to help people with the problems they're experiencing day to day.
I want to thank the Honourable Lady for Glasgow West for her intervention. On my select committee, I'm a member of the Housing, Communities and Local Government Select Committee. We have found the Housing First programme very important and useful, which has some parallels in this. She uses the words, Mr Vickers, of it's not just about drug use, the simplicity of tackling drug use. We need to tackle homelessness for the housing problems, we need to tackle drug use for the drug problems, but it's a part of a package of measures of support, and I hope we can treat both those problems equally and in a comprehensive manner. I do think we need to lessen the taboos of drug consumption that allow us to tackle the issue in a far more humane way than we've done as a country previously. The current system fails too many people. Far too many die when they're in contact with treatment services, and too many families are left grieving following an unavoidable loss. Helping people avoid that fate requires a fresh approach that prioritises health, harm reduction, social support and rehabilitation as much as law enforcement. We must recognise that outdated drug laws are not protecting people, especially young people, from harm anymore. Legal reform for cannabis would take power away from criminal gangs, regulate the quality and the potency, and provide safe access for adults whilst protecting the young. This is a pragmatic, evidence-based approach which informs what our decision should be, and it shows what other countries have done. We should learn those lessons. In conclusion, Mr Vickers, drug-related deaths across our country remain unacceptably high, particularly in Scotland and Glasgow. The situation in Scotland and Glasgow requires urgent, radical thinking. We must invest more in treatment, rehabilitation, support labs and services to reduce harm, and promote public health leadership that brings us into the 21st century. Above all, we must honour the lives lost by making the change that prevents others from dying needlessly by taking an evidence-based approach as recommended by this committee report. Thank you.
Shadow Minister Matt Vickers.
I'd like to thank you, Mr Vickers, for chairing this debate today, and the member for Glasgow West for bringing this important debate today. The prevalence of drug deaths and the broader misuse of drugs we've seen in Scotland are devastating. Even though it was welcome to see a fall in drug deaths in 2024, it remains the highest in Europe. I understand that between March 25 and May 25, drug deaths actually increased by 15%, with statistics also showing that people in deprived areas in Scotland are 12 times more likely to die of drug misuse than people in the least deprived areas. We all recognise that this must change. Nevertheless, the question of how we achieve this is not simple. We're right to reflect how we reached this situation. This monumental failure of the SNP Scottish Government is apparent. Former First Minister Nicola Sturgeon admitted that her government had taken their eye off the ball. I dare say that this turn of phrase vastly understates the scale of the crisis which has gripped individuals and communities in Scotland. As my former colleague, the previous Scottish Conservative leader, said when putting forward his bill in the Scottish Parliament to address this problem, this is a crisis that was made in Scotland, and it's one that can be fixed in Scotland, but not if we do not have willing participants in the Scottish Government. I'll return to the efforts made by my Conservative colleagues in Holyrood later. However, we believe there are approaches to dealing with drug use which must go beyond the narrow debate about drug consumption centres. Let me be clear, both the Conservative Party and I respect the independence of the Lord Advocate as the prosecutorial authority in Scotland. The last government was clear that provided that power is exercised lawfully, we should not stand in the way of it. The respect